live streaming has started. Once it has done, I will let the chair know and we'll get the meeting underway. Thank you. Okay, I can confirm that the YouTube live stream has now started. Chair, if you'd like to start the meeting, thank you.
Good morning, everyone. I would like Paul to do a roll call of everybody that's here for the members of the public.
Okay, members, as we do in other meetings, just to take a quick roll call of attendance, I'll read your name out. If you can unmute your microphone, confirm your attendance at the meeting, and then mute your microphone once again, please. Councillor Bell. Councillor Bell, are you here?
Sorry, yes, I'm here. Thank you.
Thank you, Councillor. Councillor Crumby.
Present.
Thank you, Councillor. Councillor Mrs. Cully.
Yep, here, thank you.
Very much. Councillor Curry.
Here.
Thank you. Councillor Holroyd.
Yes, present. Thank you.
Thank you, Councillor. Councillor Lang.
Present.
Thank you very much. Councillor Layton.
Present.
Thank you, Councillor. Councillor Michael Nicholson.
Present.
Thank you, Councillor. Councillor Preston.
Present.
Thank you. Councillor Renton.
Present.
Thank you very much, Councillor. And Councillor Andy Scott.
Present.
Thank you very much, Councillor. Chair, just for your information, we also have Kevin Kelly, Christine Shields and Philip Hazelhurst in attendance at the meeting this morning. Thank you.
Thank you, Paul. Are there any declarations of interest? I see notifications. Next, item 3 is to approve the minutes of the scrutiny held on the 25th of August 2020. There are 4 pages. Are we happy with those? Can we have a mover and a seconder, please? Councillor Holroyd and Councillor Layton. Thank you. Item 4 is the COVID response, a verbal update from the Assistant Director of Commissioning.
Good morning, Councillor Curry. Morning all. Just to give a brief update, focusing on care providers if I can. We have, since the 28th of September, had 5 outbreaks of COVID within care home settings. These have been robustly overseen by our outbreak control team. 2 of those outbreaks have now been closed and have been dealt with. 2 have been contained, and 1 of the homes who had experienced this is closing. That was due to safeguarding reasons, however, more than the effect of COVID. Since the 28th of September, we've reported 82 residents within care home settings and domiciliary care settings who've tested positive for COVID, and 75 staff members who've tested positive for COVID. And the majority of those have been within those settings where outbreaks have been experienced. But interestingly, a great many of them have shown asymptomatic diagnosis. So the impact has not been as extreme as in phase 1 to date. We continue to monitor staffing levels in care home settings and care provider settings really carefully, and also to monitor occupancy levels to ensure sustainability of providers. And to date, I've got no concerns to raise with members. We are working very closely with our health colleagues in the CCG, who are commissioning additional resource over the winter period to support hospital discharge. And we're focusing that on a home first approach, putting additional resource into our domiciliary care rapid response service at the front door. We are also looking, as all of the other local authorities have been asked to do, at providing designated beds within care home settings or other settings for people who've got positive diagnosis and are needing to be discharged from hospital. We are in the process of allocating our infection control funding, the second phase of that currently, and care homes will be in receipt of that initially within this next week. Domiciliary care, independent supported living and other community support providers will be allocated their funding within the next few weeks, and we're working closely with regional colleagues so that we take the same approach or a similar approach across the region. And lastly, we have developed, as requested by the Department of Health and Social Care, our adult social care winter plan. And I can provide assurance that that plan has been provided to the lead member portfolio holder for consideration and the director of adults and children's, and will be submitting confirmation that that plan is in place by the 31st of October this year. And I'm happy to take any questions, Chair.
Okay, I can see Councillor Scott would like to ask a question.
Okay, thank you, Chair, and thanks very much, Christine. That's really helpful to know all that. I just want to ask a question around. Obviously, we've got this is relating to frontline staff and the protocols around infection control. Are there any formal arrangements now that we are applying to our staff in terms of, for example, extra use of masks, things like that? Is anything being formalised around how people should operate within when they're at work? Firstly, for our staff, and secondly, for the other care providers, is there any protocols, any expectations out there?
Absolutely, Councillor Scott. We work really closely and have done since the emergency period started with our colleagues in public health. So we make sure that we follow national guidance around infection prevention control protocols, and we do that with our care providers, so we ensure that they receive timely and accurate and understandable guidance that's given from government. Obviously, the guidance has changed quite rapidly, and we make sure that as the changes come, we ensure the care providers and our own internal staff receive this. We certainly monitor that usage of PPE carefully, and we monitor whether care providers have sufficient PPE in place for a good period of time and support them if those supplies run low. However, to date, we've had very little need to do so, thankfully. So yes, the protocols are adhered to, and we work with CQC colleagues as well, who are also responsible for monitoring infection control measures.
That's great, thank you. Can I just ask a secondary question? Our Director of Public Health, Miriam Davison, talked about concerns where people are car sharing.
Yes.
Has there been any sort of work done on that? Any thought about car sharing and what we can do about that?
Yes, obviously we've heard that that was an issue. We've investigated that with our public health colleagues and certainly sent messages out to staff reminding them and provider staff, reminding them of the necessity to ensure that they adhere and comply with national guidance around infection control. The infection control team work very closely with both ourselves, our in-house staff and our provider colleagues, providing training, ongoing training and ongoing guidance and advice around that.
Thank you.
Thank you. Councillor Holroyd.
Thank you very much. I just wanted to ask about the adult social care winter plan, and will a copy of that be sent to us, or is it available online or anything like that? Are you able to give us any details at this stage?
Yeah, what we've done is there's a raft of key areas that we have to adhere to. So we have a table, a pro forma that we've actually completed to provide assurance about what is in place, and if there are any outstanding areas of work, what mitigating actions that we've put in place. I'm pleased to inform members that we've got all of the key areas covered, and we are actually in line with all of the requirements from government and the Department of Health and Social Care around that.
I'd like to ask a question. There's nobody else put their hands up. Of the 5 homes, you said that one was closing due to safeguarding issues. Is it going to be a later close after the contamination has been removed from the home, and do we have enough places for them to be moved to safely? They're not going to be moved into a home where there is an outbreak.
Just for information, members, it's actually a home for people with learning disabilities, and it's one that we don't actually commission with directly ourselves. It's not on our framework of providers, and we don't have any of our residents residing in that property. But the people who are there, and there are only a handful, their local authorities are making necessary plans to move them to alternative provision currently, in a safe way as well.
Thank you. Okay, no more questions on that item. Okay, we move to the item number 5, which is the deprivation of liberty update, report from the Acting Director of Children and Adult Services.
Hi, shall I start then? It's Kevin Kelly. I'm going to talk to the report today.
Yes, thank you, please.
Good morning, everyone. I'm going to run through the summary of the report that you should all have in your papers. Just to really start off with, dogs, it came into force in England and Wales on the 1st of April, which is via the Mental Capacity Act. The local authority has a legal framework, a legal responsibility to ensure that the deprivation of liberty safeguards are implemented. We have the statutory responsibility as a supervisory body for overseeing MCA dogs, which includes the assessing and granting otherwise of all dogs authorisations received from managing authorities. Just to kind of bring you up to point 5 in relation to the COVID outbreak and the directions from the Department of Health, we received guidance in April of this year regarding visits to care homes, and it was the guidance and the advice was that we had not to visit care homes at that point in time because of the COVID outbreak. Now, as you'll see further down in the report, there's reference to further guidance. It was issued on the 9th of September, which we'll go on to discuss a bit later. However, there has been more guidance issued recently on the 14th of October, which has an impact on the way that we operate our assessments. Just going down to the main report, it gives you the history of MCA dogs, and as you'll see that due to the Cheshire West judgment in 2014, we've seen a significant rise in dogs due to the change in legislation. So the figures there takes you down to from 2012-13 up to 2020 August figures, which are obviously less than the yearly figures, but we would anticipate that it would be the same figures for the end of this year as it was for the end of last year. And then you can see as you go down the number of DAWLS requests. I have the figures there show that they have significantly increased in that time. And you will see that in the northeast of England has consistently the highest levels of DAWLS requests and authorisations in England. So just in terms of the challenges, and these are the challenges that we've highlighted in previous reports that's come in the last several years, with needing to ensure that we have appropriate resources in place to ensure that we meet our legislative responsibilities. We've taken a proactive approach in Darlington to ensure that we are aiming to complete as many within timescales. We have increased our resources and permanent resources, as well as using independent BIAs. And then as you go down to the table below, point 19, you will see the figures there from 2015-16 up to 19-20. I do have the figures actually for 13-14. Which obviously was before Cheshire West, and there was no budget for the independent BIAs, and the total amount that was spent on that year was just over £56,633. So just to talk about now the more recent developments around the impact of COVID. So as I'd mentioned earlier, we had a Department of Health guidance issued in March and April, which we adhered to, which requested that we do not visit care homes, and we employ other ways to ensure that our assessments are completed. And we employed a numerous different ways to do that. And including the use of technology and sometimes get into the garden area and or through windows or through a whole manner of means, including historical information to gain the information that was required, and that was done by the DAWLS assessors as well as the RPRs. And as you can see that, that has been that's been challenging and difficult. But what I will say is that in that period, staff, both in terms of assessors and those in care homes, became quite adept and quite skilled at being able to elicit the information that it was required, and more confident in doing so. But obviously, it doesn't replace face-to-face visits. It's the same with our colleagues in the RPRs in terms of using the same methodologies. And really, as just to pick up, something that Christine had said a few moments earlier, we work really closely with our commissioning and contracts team with the care homes and supporting them in a number of areas, and obviously this is one of them which we have been doing so. So just moving forward down through into the deprivation levels and settings other than care homes or hospitals, we've continued to be able to move the court of protection work at a quicker pace than that we had anticipated. And although there has been some delays, it has been minimal. And as you can see, that in terms of the advocacy, the RPR role, we've continued to be able to operate that within the bounds of the COVID restrictions. So what's not in this report is the updated guidance that came out in the last couple of weeks, and that updated guidance is now reverted back to the position that, or more or less reverted back to the position that we had in April, and that advice stipulates that in areas where the COVID alert is high or very high, so currently in Darlington we are high, face-to-face visits should only occur in exceptional circumstances. And that would mean a visit is the only way to meet the person's specific communication needs in urgent cases, or a meeting is needed to avoid a breach of human rights. We've updated the local guidance, and that's now with BIAs and mental health assessors, and with colleagues in commissioning and contracts. So the other main kind of issue, really, in terms of the deprivation of liberty safeguards is that obviously in the last couple of years there's been a law commission review that has found that that it's quite an unwieldy and difficult to implement process, and there's been a recommendation that it will be replaced. Now that was meant to come into force in April this year. However, at the very outset of the pandemic, that was paused, and then over the summertime, the scheduling for that was moved to April 22. So that will come into force in April 2022. We still have a consultation and guidelines to be conducted and issued, and we have had a task and finish group with relevant officers and partners up and running for some time. We've been waiting for the guidance, the consultation, the guidance to be completed, so that we can then look how we can implement the new LPS. That task and finish group will continue to meet and will take into account when the guidance is issued, and timetabling for the guidance at this moment in time, other than that we would expect it in the next 6 months. And as you can see here, the main areas of change within the LPS is quite significant. For us in adult social care, we will continue to be responsible for the supervisory duties, but we won't be. We'll be looking at moving to approved Mental Capacity Act professionals, AMCAP as they've been called, which we believe will be from our existing workforce. We may need to review that when the further information is made available. But in terms of obviously training our workforce and to ensure that they are appropriately trained, and the new LPS will be one of the task and finish group's main tasks. The other significant impact really will be on children 16 plus, and adults will need due respect in regard to deprivation of individuals in all areas. So we will be so it will take into account the legislation will include adults who, young people who are 16 and 17. We have, as part of our task and finish group, representatives from Children's Services, so we've connected with that at an early stage. Okay, I'll take any questions if anybody wants to ask any for further clarification.
Councillor Cully.
Thank you, Chair. Point 14. The North East of England has consistently had the highest level of DOLS requests and authorisations. Do we know why?
Other than that, we are fulfilling the spirit and the letter of the law. I think that the difference is that we have taken a very proactive approach, and there will be other regions and other areas and local authorities who may not have taken such a proactive approach, which is not as counter effective to the legislation, and could put people at risk.
Councillor Scott.
Thank you. Question on paragraph 13 says 701 requests were received but did not proceed to authorisation. Can you give it a bit more context on that, please?
Okay, so I might just ask my colleague Phil Hazelhurst to respond to that question.
Certainly, yeah, that's fine. So in the DOLS process, we obviously have individuals who go into care homes for very short spaces of time. We also cover people who are deprived within hospitals, so they may only be in a hospital for a day or two. So we may have a request, but that may not proceed based on those individuals actually leaving the hospitals or moving back home. And obviously DOLS is only for care homes or hospitals. So then therefore that would come to an end.
Thank you.
Councillor Holroyd.
Thank you, Chair. I have various questions. On point 18, it's mentioned that the full-time BIAs were moved to cover other roles during the coronavirus outbreak, and therefore we had to employ independent best interest assessors. Would it not have been better if that was costing us extra to find other staff who were not as essential to the continuing operation, to move them so that experience wasn't lost? I imagine it's quite costly to employ external people with the requisite skills and knowledge.
I believe that that happened actually pre-COVID, and it was during the time where the safeguarding team was particularly under staffing pressures. So if we'd had more BIAs that we could internal BIAs that we could rely on, then we would have used those staff. The other context to this is that the training, having anticipated that this was going to come into effect, in the very near future, the training for BIAs has been winding down over the last couple of years. So what we have, and with anticipation that that particular training won't be required with the LPS introduction, obviously with the delay now, we've been back to some of the training providers and have inquired about doing further training in relation to the current BIA training programme, which we now have some staff who are scheduled to go on that. So that will give us that wee bit more capacity in that time frame between now and April 22.
Thank you. I do have a couple of other questions, if I may. Let's find them. During the capacity assessments during the coronavirus lockdown, how were the DOLS assessments completed to gain the necessary insight into the patient's capacity and staff experiences? Or
I'll ask Phil to answer that question if you.
Sorry there. Hi there. Yes, so capacity assessments are completed by the Mental Health Act Section 12 doctors. That's part of their role. What they would do is they would use, obviously, for people who are previously known, they would use knowledge of the individual from previous. They would obviously be able to gather information from the care homes themselves and family members if required. And and capacity assessments were completed based on that knowledge and understanding. Where required, where required, they were able to go in and obviously complete capacity assessments, but if they had that information, they avoided that.
Thank you. I've answered that one already. I think you may have answered this one. You mentioned in the changes to the legislation that it's now for 16-year-olds and over. Was it previously only for over 18s? Okay, thank you.
Yes, that's correct.
Yeah. And also, forgive me if I'm wrong, but it mentions that local authorities will now be responsible for. It sounds like that local authorities will be responsible for more, and we can expect the number of these to go up. Is that the case?
So, in relation to DOLS, DOLS only relates to people who are within care homes or hospitals. Within relation to LPS, Liberty Protection Safeguards, that will cover all people in the community as well.
Yes.
So obviously that will increase the numbers of consideration of deprivation.
Will there be kind of cost implications of this, and is central government providing any assistance as far as the impact of this legislation on local authorities?
At this time, that we obviously need to gather further information, and is dependent on the guidance that comes out and how that will move forward. At this time, when we're not anticipating a significant increase based on the fact that we do have all of our social workers who will be it will become day-to-day business, and obviously they will be considering the deprivation of individuals for all of their individuals that they're supporting.
Does that mean that for those social workers who are, shall we say, less fond of the paperwork side, it might change their role slightly? Would we expect any people to leave, for example, because there's an increase in the paperwork?
I wouldn't expect people to leave based on the paperwork. This is obviously a national legislation which all social workers will be required to fulfil, and of course it will be part of their developing role. But obviously I don't know if Kevin wants to come in there now.
Yeah. I mean, I think this is what's recognised as that mental capacity skills is a key and core skill for social workers, and it doesn't necessarily need to be in a specialist role as the BEIA is currently so it's an opportunity, actually, I think, more than it is a concern really in terms of additional work. It's an opportunity for social workers to develop those skills, because they're asked to be using those skills on a day-to-day basis anyway, and it's a really fundamental part of their job as a social worker to ensure that people are appropriately safeguarded and that their human rights are protected. So I think that's part of the reason, it was described as a bit unreal, though, because it created a layer that it possibly never needed to be created, but it was obviously a response to a certain set of circumstances in terms of Cheshire West. So now that there's been an opportunity to reflect on that and to look at what is the best way forward, it's done in tandem with a recognition and acknowledgement that social work skills in terms of mental capacity is a real core function.
And finally, it mentions, it's part of point 29, that capacity assessments are specifically relating to care arrangements. Does that mean a new assessment has to be done every time somebody's care arrangements change?
Yes. So in relation to capacity, obviously it's specific to time and place, and therefore should any arrangements change, then yes, a new capacity assessment will be required. Yeah, and that is obviously across all working practice at this time as well.
Yeah. Okay, thank you.
Thank you. Councillor Renton.
Thank you, Chair. I'm just trying to get a better understanding of the year in Part 19, the year 2018-19. As you have the lowest or third lowest independent BIA spend, but the second highest mental health assessor spend. But it says you've took on an additional member of staff, BIA staff. So I'm just trying to understand how those costs correlate.
Sorry, Councillor. So in relation to in part 19, so did you say?
Paragraph 19, the cost table, 2018-19, you got 115,000 BIA spend and 165,000 mental health assessor spend. But it says there were additional pressures in 2018-19, so you had to take on an additional member of staff, but it's a lower, well, almost considerably lower cost. So I don't.
Yes. So in relation to, so that graph is referring to independent BIAs. So those are the people who we pay for outside of people who are employed within the council. So obviously by getting so what that graph is showing on that 18-19 is actually showing there was an improvement in costs because we'd taken on that extra worker. So therefore the independent BIA cost reduced. So that's how that's figured.
That makes sense. So would it be fair to say that because you had additional independent spend, that's why we had more mental health assessors, because we had a more efficient system for a short period of time?
So yes, so in relation to mental health act assessors, they are paid obviously dependent on how many they do, and that covers everything. So every assessment that we receive requires a mental health act assessor to complete 3 of the assessments that are required. So therefore that would be a standard cost. In relation to the independent BIAs, yes, there was a saving based on the fact that we brought in the extra BIA within the council.
Okay, thank you.
Thank you.
Councillor Layton.
Sorry, it's just a sort of a general question about moving towards April 2022. And what I was sort of concerned about was I'm hoping that by then that we have a better understanding of and have sort of coronavirus under better control with the obvious treatments and vaccines. But when we consider what's going on now with the legislation and how we're having to apply, how we're having to sort of deal with going into homes or not going into homes and various other sort of things that skew the process of administering DOLs. Is there some way when we're sort of doing the task and finish work that this can be taken into consideration so that when we come to April 2022, we don't have a more stringent sort of process for DOLs, or we're not including things in that in assessments that have sort of been skewed by the sort of necessity of having to do things related to coronavirus? I don't think they're suddenly going to lose more liberties because of coronavirus, but obviously, over a 2-year period and what we've been going through and some of the restrictions that are applying already, I think it will slant how we're thinking about DOLs moving forward. So I was just wondering if there are any sort of safeguarding measures and strategies to take that into consideration. Thank you.
I think that the guidance that's to be issued, obviously following the consultation, is going to be really key to that, and the consultation will hopefully take into account the impact of COVID has had on DOLs. And I think we all want to get back to face-to-face assessments as quickly as possible, but it has to be done in the context of the current infection. And it's interesting that we we went to a position in April where the advice was from the Department of Health not to do face-to-face visits, and then we moved in September to come back to face-to-face visits as a response to the evolving situation with the infections. And in fact, we kind of started back in August, and that again, that was taking into account the relationships that we have with care homes and the ability to be able to move speedily, and safely when we can. But I think that the question, your question is a very interesting question, and I'm not sure whatever any of us really have the answer to that at this point, other than the kind of administrative aspect of it, which has been, part of the reason for the review is something that we hope to be able to work with more positively and get to a more usable, and user-friendly and workable system. But there's no doubt that the impact of non-face-to-face visits is going to have a real impact on the guidance. I mean, I think we all feel very strongly that that in terms of people's human rights, that having that face-to-face visit is really important, and that's something that we will keep a very close eye on as we move through the winter, and we will take this on a week by week basis, because we've the strength of feeling in terms of being able to exercise our duties in the way that they should be is a strong motivation.
Can I just say thank you for the answer, and thank you for the work that you do, because it's not the sort of hands-on side that most people recognise in care, but it's absolutely critical, and it's something that having experienced, that sort of input with my own mother, you just can't move forward with any aspect of somebody's care without the teams and the social workers. I don't know any group that have to deal with more paperwork than the teams of social workers I've had to deal with my mum. They've been absolutely fantastic, and I just want to thank everyone for the work that they've continued to do throughout the crisis. It's been amazing. Thank you very much.
Thank you.
Thank you. There's one area that I would like to ask a question on regarding end of life and the deprivation of liberty. I belong to a Facebook page for carers of dementia and Alzheimer's, and people who've had their loved ones in care homes have not been allowed to be by their side as they go into the final stage, the last few days of life and the end of life care. Do we have any policy to try and make sure that they don't then suffer problems with their mental health because they've been deprived of being with their loved one? Or do we have a policy that allows them to go to be with their loved ones at the time of the end of their life? It's a reassuring phase for the people who suffer with dementia to have their loved ones there, just a friendly voice that they understand and can hear. It's a complaint around councils all over the place, and people are complaining to their councils if they haven't been allowed to be with their loved ones at the end of their lives. Do we have any stance on that?
I probably can't answer the aspect of the question around what individual homes policies are, other than that. What I'm aware is that individual homes will have perhaps a variation on that. I think that the question is a really important question, and I think it's just one of those horrendous situations that this virus has brought upon people, that they feel that they find themselves in that difficult phase in their relatives' lives anyway, but to face it in those circumstances is just is really difficult. So I think Christine might be able to help you with that aspect. However, in terms of the wider mental health implications, I think that's another really it's another really kind of significant issue that I think we're only just beginning to scratch the surface of, and we are doing some work to try and understand from a performance point of view the Mental Health Act assessments rate, and who seems to be the group, or if there is any group of the society that are struggling the most. And I think we're seeing a rise in younger people who are needing Mental Health Act assessment, and older people. So the both kind of range of the spectrum is seeing a real kind of hit. And when we talk about Mental Health Act assessment, we're talking about the worst case scenario. So the low grade, if you can describe it as that kind of onset of like mental health issues such as depression or grief reaction, is something that I think is at this moment in time, it's you can feel it, but I don't think it's been fully quantified. There is another piece of work that I've started to do with some colleagues in health to look at a recovery model. I'm in the very early stages of that, and some of the discussions that we've been having is on the back of the questions like you've asked, so what are we going to do, in the short, in the medium, and the long term. But I think there is an investment in that, and a commitment to that. What it will look like going forward, I just don't know. Other than that, I think we all feel and believe that there's going to be quite a significant long-term impact on people's mental health as a result of the crisis.
Thank you. Christine's got a hand up, yeah.
Thanks, Chair. It was just to confirm what Kevin's really said. Each of the care homes have their own risk assessment in place around visiting arrangements, and that's very much guided by the national guidance and sort of support from our public health team. The infection prevention control monies were predominantly allocated on a registered bed basis, and that was predominantly to look at workforce and making sure workforce and staff weren't moving between buildings to try and prevent transmission of the virus. However, we did have a smaller pot of that money which we could use in whichever way we felt that we would benefit care providers most, and we did use some of that for innovation and for technology. So we've used that to make sure the care providers can put in place garden pods or isolation rooms to really maximise and prevent carers not being able to access the loved ones in a very safe way. And if that's not possible, then at least to have iPads or tablets that they can converse and see their relatives, albeit digitally. So we did have that innovation fund available for providers.
Thank you. As I look after somebody with Alzheimer's, it's the touch that makes the difference, and unfortunately that technology can't replace that. It's a difficult time. I know it's been dreadful around the country, but some places are letting people in and some aren't, and it is causing a lot of upset for those people who can't get in when other people, they know other people can. Dreadful situation for those people. Thank you very much. Okay. There is no more hands up for that section, so we go on to the work programme.
Would you like me to say a few words around that, Chair?
Yes,
so we've put that in and scheduled that for the 5th of January, so that's actually in now for the next meeting. Obviously, as we did at this meeting, we will be having a verbal update on the COVID response at the start of each meeting, so members will have the opportunity to hear more there. And again, I've factored that in on the work programme. And members have probably picked up that the scrutiny committees will actually be analysing the medium-term financial plan, or certainly those areas within their remit, in the January, February time. So again, that's been scheduled for the meeting on the 5th of January. One other thing to maybe sort of like mention to members, obviously we did have a meeting of the Loneliness and Connected Communities Task and Finish Review Group on the 5th of October. I have drafted some notes. They are with the relevant officer at the moment, just checking them over to make sure that I have picked up everything correctly. But as soon as I get them signed off, I'll get those circulated to members. There were a couple of actions that were identified from that review group, and I'll be looking to progress those in due course. Thank you, Chair.
Thank you, Paul. It looks like a very busy meeting in January. Any comments, any questions to that report? Councillor Layton.
Could I just make a request? I think it's been made before. It's just a sort of a technical issue that when we have tabulated information and it's printed on A4 paper, if it was possible, I think someone's requested this before, that we have the tables switched to landscape so that you can get, for people like myself who've partially sighted, can read it in a bigger format. So currently we have the A4 paper with the table across the middle, and sometimes it would just help if it was just switched to landscape so we could see it in a bigger format. And I'm not squinting because these aren't too bad actually, but some of them, when the information's quite dense, they're almost impossible to read. And I don't think it's just me. I think there's been a few people have commented before, so it was just a special request.
No, absolutely fine, Councillor. I mean, the actual document itself is produced in a landscape format rather than a portrait format, so I think it's an issue. Obviously, I'm working from home currently, so I don't have access to the printer myself, so I'm reliant on others printing for me. But I will highlight that we want that
lovely.
specifically in landscape. Thank you,
Thank you
Councillor.
very much. Thank you.
Councillor Holroyd.
Thank you. Just looking at the forward plan, it mentions the Disabled Facilities Grant, which I imagine might relate to our area of work. Obviously, if it's going to Cabinet on the 10th of November, we won't be meeting again before then. But yeah, it's too late to put it up now. But it would be interesting to see the contents of that and how it relates to adult social care, certainly. Yeah, should have pulled it up before if I wanted to look at it, but yeah, just wanted to flag that briefly.
I think Christine Shields wants to reply to that.
Oh, hello. Yes, I actually oversee the Disabled Facilities Grant coordination and everything. So it will be me bringing that report into Cabinet. I'm happy to circulate a briefing around that and our proposals. It's been out for public consultation and it's been positively received by partner groups when we've been going through that consultation period. But I'm happy to circulate, Paul, if you remind me, a briefing to members around that.
No problem, Christine. I'll note that.
Thank you.
Thank you. No other questions to that. Item 7, supplementary items, and there is no supplementary items for this meeting. Number 8 is any questions. Do we have any questions from the committee? There are no hands up. I see no other things on the agenda, so we could close the meeting. Thank you very much for all attending. It's been a very useful and interesting meeting. Thank you.